Hello and welcome to Diplomatic Passport on Zimpapers Television Network ZTN, hashtag Get the Picture. A program where we give you daily updates, statistics, Zimbabwe's preparedness and the general response to the COVID-19 pandemic, along with regional as well as global trends. My name is Blessing Munatsi. Let's start by giving you the latest figures released by the Ministry of Health and Child Care, recording 51 deaths yesterday in Zimbabwe and 686 new cases of COVID-19, bringing the number of active cases to 29,298. The cumulative number of cases now stands at 109,546, and of these, 76,665 being recoveries, while 3,583 resulted in deaths. Harare is the main hotspot, having recorded 107 new cases of COVID-19, and eMakhandeni in Bulawayo being red flagged, recording 19 new cases. Zimbabwe currently has 606 hospitalized cases of COVID-19, and of these, 139 are new admissions, 129 are asymptomatic, 179 are mild to moderate cases. 81 of those admitted have severe symptoms, while 24 are in the intensive care unit. Zimbabwe's vaccination program continues, and the latest data that we have, 8,513 people received their first dose by the end of the day, yesterday bringing the cumulative for the first dose to 1,654,112 people, while 11,319 received their second dose, bringing the cumulative for the second dose to 779,229. Now, our diplomatic passport takes us to the southern part of Zimbabwe today, in Bulawayo, where we are joined live on our virtual platforms by Professor Solwayo Ngwenya, Mpilo Central Hospital Acting Chief Executive Officer. It's very good to have you, Professor Ngwenya. First of all, to get your views on the pandemic, can you tell us, take us through the situation of the COVID-19 in the wards, being on the ground and being a frontliner at Mpilo Central Hospital?
Yeah, the situation is really terrible. It's more than dire. In the first and second waves, a lot of people got infected and they didn't fall sick. So they didn't go to the hospital to seek care. So now in our wards, they are filling up and people are coming in every day, and some of them we are losing them every day. And when you go inside the ward, they are really sick, they are coughing, they are needing oxygen, they are struggling for breath and so forth.
Now, obviously, running such an institution, Professor Ngwenya, which is a key COVID-19 center, has its ups and downs. What have been some of the key challenges, especially as we battle with this third wave running through this current stage?
The key challenge is that the wave is quite overwhelming, and we were not prepared. I mean, nobody thought this wave will come this fast. And people coming in very sick, as I said, some of them, we lose them even before they are admitted, just on arrival. So this has also affected our staff members. Some of them are being infected on a daily basis and having to go home on isolation and further depleting our numbers. So the public behavior is really critical, because that person you see in public transport not wearing a mask properly is going to contribute towards a huge crisis in the hospitals. So in this time, we are really going to be stretched out, because I see this ongoing extreme compliance is ongoing. There's nothing stopping it. So we are spiraling out of even more difficult situations going forward. So those challenges are that we are having staff being infected, we are being depleted, we are seeing a lot of sick people, and we are ever having to innovate and create more space to accommodate the ever increasing numbers of patients.
Yes, that is actually accurate because we do have a number of frontline workers falling victim. But looking at this particular variant, the Delta variant, what needs to be done? Because it seems that it seems to be mutating more, especially in the unvaccinated populations. It is propagating more there. What needs to be done for us to be prepared? You did highlight that we were not prepared.
Yeah, right now, I will talk about the coronavirus in a global sense because remember, this is a global pandemic. So it's difficult for Zimbabwe on its own to try. While we are doing our local measures, another country may be relaxed and then another variant comes, like what happened now with this Delta variant. So we need to, I know we need to vaccinate people, but it's difficult now to try and vaccinate during this terrible crisis. What needs to happen is to tell the people that we are facing this terrible thing and we are going to lose more and more people going forward. So I will have a model whereby we lock down people for 21 days. Then we use these 21 days to mass vaccinate them. And also, once they know that this is a serious lockdown, like the first one that we did, the first 21 days, everyone was made aware in the country that they were facing a serious situation because they could see even from a government level that is able to shut down everything completely. So during that period, then once people are vaccinated wherever they are in the local clinics, they are not moving up and down the country, we will be able to stop this spiraling out of control. Otherwise, if we don't take any drastic measures, I am telling you the numbers that we are seeing are just the beginning of a terrible, terrible numbers.
Most certainly, all people need to play their part in this fight against the COVID-19 pandemic and observe the regulations that are recommended. Professor Ngwenya, let's take a look at the issue of children. They seem to be left out when it comes to the vaccination programs. Yet we are seeing from the numbers that are coming out from the cases that the figures are starting to cripple in onto the children. They are more also very vulnerable to this Delta variant. What needs to be done?
In earlier variants, children were just vectors moving around the virus without them falling sick. But now with the advent of this new Delta variant, which seems to attack almost even from neonates, we have seen neonates, we have seen children. So, and the studies that were done on the vaccinations were not done on children. They're only starting to conduct them now. So governments have been unable to vaccinate children. So, children also have to go to school, and so there's pressures from school. So we are facing a dilemma now of if we open school, we are opening floodgates where children are going to be infected, and we know this variant may even kill them. At the same time, you try and say you want them to go to school. So the Delta variant is really presenting a terrible situation in the global sense in Zimbabwe and everywhere.
Most certainly, more research is needed, and we're starting to see that research coming through. Another area maybe that would need research, Professor Ngwenya, the immunity. If we look at immunity, can arise through either natural means or through artificial means, which is the vaccination. Now, for those people who have recovered from COVID-19 per se, would it be okay to assume that they have developed natural immunity in terms of the antibodies, and is it prudent to have them vaccinated as well, or this is an area that also needs more research?
Yeah, one thing you must understand about this variant is that this virus is always ahead of us, it appears, because we are the ones who are fueling its mutating and growth by our extreme complacence. So what happens is the vaccines were made when we had weak strains, but now we have got this virulent strain of Delta variant and so forth. So you find that your natural immunity, it wanes anyway. After, I think, 3 to 6 months, your immunity starts to wane. And this new variant has found a way of latching onto your cells and evading your immunity. So by vaccinating, they try to make sure your antibody levels are increased significantly, hoping that you will be able to withstand this terrible variant called Delta.
Another vulnerable group, maybe to talk about the lactating and breastfeeding mothers. Do you feel that we have done enough in terms of research to make sure that this group is actually safe to receive the vaccine?
Yeah, they are now in overseas. They are now recommending that the pregnant women and lactating mothers should get the vaccines. There haven't been any serious reports of them having serious side effects from them. So the current thinking and global thinking is that yes, the lactating mothers and the pregnant women should be vaccinated.
Now, since the inception of the vaccination program in February, we've seen myths and misconceptions around this issue of vaccination. A lot of hesitancy to actually take it on board, and we're starting to see now the acceptance of viral vector-based vaccines. Johnson & Johnson recently approved in Zimbabwe. Is it advisable, to have different types of vaccines within the country being given to the population?
I think it's a very good thing to try and have a basket of what is available, because you know what happens with the immunity. I think as long as you get one of the small particles into your immune system, your body will automatically react. So whatever, whether it's viral vector or attenuated or messenger RNA, I think if you have a chance, you can get those. And the government has done well by adding another vaccine into the basket. So as we go forward, because some of the manufacturers clearly state some people shouldn't take this vaccine. So if you have few vaccines, then you limit the number of people who are able to be vaccinated, and you also cause some hesitance. But by bringing up a basket of them, I think the government is done well, and it will increase the levels of vaccination.
Now, lastly, Professor Ngwenya, before I let you go, we have seen quite a number of deliveries in the ongoing vaccination. Zimbabwe taking stock and receiving more than 6.7 million doses now, cumulatively. We're told they've secured 12 million doses under the $100 facility. Do you feel that we are still on course to achieve herd immunity and hit the 10 million mark that we're targeting by the end of this year, which is the 60% of our population?
I think we are doing very well, because you see, remember, these vaccines, everyone is trying to grab them everywhere. They're in short supply. We are not able to manufacture them, but the government and been working with the Chinese government to get us this vaccine. So we have done extremely well to get millions of doses available. So I think with the current problems that are facing vaccines globally, we are doing very well. We should continue on this trajectory, and we will be able to hit, even if it takes us longer, but we will be able to hit our herd immunity.
Professor Solwayo Ngwenya, I have to thank you so much for making time for us during Diplomatic Passport. Thank you for giving us all those insights, and it is your duty and mine out there to make sure that we play our part and stick to the recommended WHO as well as Ministry of Health guidelines in order to prevent the spread of COVID-19. Another developing and interesting development overseas, the United Arab Emirates will start providing China's Sinopharm COVID-19 vaccine to children aged 3 to 17 years. And the government said on Twitter on Monday that they will be going ahead with this. The UAE Health Ministry authorities said in June the trial will monitor the immune response of 900 children. The Gulf Arab state, which has amongst the world's highest immunization rates, has already provided the Pfizer BioNTech vaccine for children aged between 12 to 15. So it's lowering the age limit for the children to be involved in the vaccination program. We did highlight that a little bit with Professor Ngwenya just in the interview right now. Now, the Health Ministry in UAE said on Sunday that 78.95% of the UAE population, that's roughly 9 million, had already received one vaccine dose, while 70.57 had been fully vaccinated. So the vaccination does continue. Zimbabwe is also on course, according to Professor Solwayo Ngwenya. Do go out there and get vaccinated. Many centers around decentralized. For today, I think that's all we have for you in store on Diplomatic Passport. We're back again tomorrow, same time, with the latest updates on Zimbabwe's COVID-19 situation. And do remember to play your part, get vaccinated, mask up correctly, and also consistently observe social distancing and avoid overcrowded places that are also poorly ventilated. My name is Blessing Munatsi. Diplomatic Passport is stamped for today. See you again next time. Goodbye.